Hello and welcome to the 12th episode of Centered Science, the community education outreach by Pusat Perubatan Naluri. We're streaming to you on Facebook Live as well as via satellite courtesy of Astro Awani. So it's been 3 weeks since the government opened a fast track line for people who wanted the AstraZeneca vaccine. I'm sure most viewers already know that offer was snapped up within hours of the website going online. And of course, we're going to have another one of those runs in the coming days. Today they opened up the line again for the over 60s, and 3 weeks down the line, series progenitor Tan Sri Dr. Jamila Mahmud, special advisor to the Prime Minister of Malaysia on Public Health, and co-pilot Professor Dr. Abdiba Kamarul Zaman, infectious diseases specialist, thought it apt that we speak about vaccine side effects.
Salam sejahtera and good afternoon, everyone. Thank you, Karen, and welcome back to our episode. It's nice to see Adiba as well, my co-conspirator, and welcome Prof. As well as Oni. So we're really happy to have you here. As Karen mentioned, we have been really ramping up. Not just AstraZeneca, but also the other vaccine tracks. I think we forget sometimes that ongoing Pfizer and Sinovac injections are going on. You may have seen in the news 2 days ago, we received more than 500,000 AstraZeneca doses, as well as more than 500,000 Sinovac. So these are all good news, and Pfizer shipments come in on a regular basis too. So we've been really busy. I've been myself personally involved with the what do you call this, AstraZeneca rollout at the World Trade Center. So it's been really heartwarming to see many people coming, and thank you for those who've been buying me coffee and food and just coming to say hello. I don't know, I've never taken so many photographs and selfies ever in my life, but everyone's been really very, very kind. And thank you for appreciating our volunteers and our staff who have been working very, very hard in all the different vaccine centers. University Malaya is also really doing a great job in the exam halls, UKM as well. And on Monday, we opened the IDCC in Shah Alam. So we're going to continue ramping up as we go. So so we're looking for, this is not the first time we're talking about vaccines or side effects, but since we are ramping up, it's always good to have a reminder. And really, we want the audience to really interact and ask us questions. Over to you, Adiba.
Adiba, your mic's muted.
You would think by now I would know how to navigate this, right? So thank you, Tan Sri, and hi, Karen, hi, Ani, hi, Sharifah. Yeah, we decided to go back to the issue of vaccine because this is, apart from MCO, this is issue yang paling hangat when it comes to COVID-19 in Malaysia at the moment. And on top of that, it's not just the rollout is increasing as described by Tan Sri, but also there's constant new information, new data, new concerns. So we're really, really pleased to have my colleague, Associate Professor Sharifah Faridah Syed Omar from PPUM. I call her the vaccine Zarina because she's the one who's together with other colleagues, Dr. Sazali and the nurses and others at PPUM have really been hard at work putting together phase 1 and now phase 3 of the rollout. And I think at the peak, I know it's no match to Tan Sri at PWTC with 8,000 people vaccinated, but you vaccinated more than 1,200, 300 in one day in phase 1. Yeah. So, and been fielding all these calls about, is it safe for me to take vaccine? Should I take the Sinovac? Should I take the Astra? Macam-macam kan? So, so we are very pleased to be able to share with you her experience and her thoughts, and Ani too.
So, Dr. Sharif, before we get on to Andre, can you just tell us a little bit about yourself? You've already had a very glowing representation from Dr. Adiba. Just tell us perhaps in layman's language, what your field of expertise is and what you actually do in infectious diseases.
Sure. Okay. Assalamualaikum. Good afternoon, everyone. Thank you so much, Sense with Sciences, for inviting me to be on board. It's such a pleasure to be here with Tan Sri Jamila, my boss, Prof. Adiba, and also to be with Anri here as well. So as mentioned by Prof. Adiba, I'm one of the infectious diseases physician in University Malaya Medical Center. So my team and I, we've been involved with the care of COVID patients initially from the beginning of the pandemic, and continue to do so. We've got, one of the biggest places where we admit patients with COVID-19 to the hospital. But in February, March this year, we started our vaccination program. So we were one of the Pusat Pemberian Vaccine for the first phase, where we vaccinated a little more than 10,000 of our frontliners over the course of about a month and a half and 2 months. So our max number was 1,300. I think that's our, peak of the vaccination. And now we've been upgraded to become a SPPV, Special Pusat Pemberian Vaccine, where we're now involved in phase 2. I have a new team on board with some overlap with the previous team as well. So I've got my public health physician, Marzuki and gang on board. So with phase 2, as with the national program, we are vaccinating those who are above 60 with comorbids, and especially those who need to be vaccinated in the hospital because of some issues where they can't be vaccinated in the community. So the focus is there. So basically, that's a bit of an introduction of what we've been doing. But at the same time, in terms of the University Malaya AstraZeneca Center, so we are not directly involved, though we did help with the setting up of the center. It's great to see UM be part of the AstraZeneca program, and we have been providing them with some guidance and advice when needed.
That's fantastic. Thank you so much, Dr. Sharifah. So also on the show today is actress, entertainer, and educator Anri Tu. She's also mother to a 7-month-old baby, her first child with her husband and my friend, producer and director Michael Chen. So Anri is with us because she had a very personal experience with the decision to vaccinate, which she will share with us in a while. So welcome to Sense with Science, Anri. Say hello and introduce yourself.
Hi, everyone. It's such a privilege. May I just say thank you so much, Karen, for this opportunity to be amidst of all this very capable panel of women. I feel a little bit intimidated. But yes, thank you so much for having me. I am, like Karen mentioned, I'm Anri. I am a first-time mother and a fully breastfeeding mother. And I just had my vaccination this Tuesday, which is the 18th. So it was quite an experience, and I actually did it in UM as well. So yeah, I guess that's why I'm here today.
So power to UM. So well, early in the series, we spoke about possible side effects of various vaccines, and we thought that it was timely that we revisited this issue in the light of so many people having received the AstraZeneca vaccine. As Tan Sri Jem has said also early on, we forget the fact that it's not only Astra, there are other streams of vaccines coming in as well. But today's session is about the possible side effects of the vaccine currently in play in Malaysia, notably Pfizer's BioNTech and AstraZeneca's Covishield Vaxzevria. So Dr. Sharifah, perhaps you can start this discussion by generally explaining vaccination side effects and why they happen.
Okay, sure. Thanks, Karen. So, vaccines generally work by preparing the body to fight infections. So when a person is exposed to infection in the future, they are sort of prepared to fight the infection. So it's a form of prevention to help you deal with infectious diseases generally. I'm sure we're all familiar with the many vaccines out there. You've heard about measles vaccine, polio, hepatitis B, the flu vaccine, mumps and rubella, and so on. So some vaccines, they work by giving you full protection against that disease, but some work by preventing severe and debilitating disease. So at the end of the day, it's preventing you from either the disease itself or developing severe disease. So the Pfizer BioNTech vaccine is a mRNA vaccine. while the AstraZeneca vaccine is an adenovirus vector vaccine. So the Pfizer vaccine does not contain any component of the live virus, while the AZ vaccine contains a modified adenovirus, which is used to transport the genetic material of the SARS-CoV, if you like. So despite them being of different types of vaccines, they work by helping the immune system to recognize the targeted virus protein. So in this case, the spike protein of the SARS-CoV-2 virus. And subsequently, this stimulates the immune system. So we produce antibodies against SARS-CoV-2 virus. And hopefully in the future, when we do encounter the real virus, our body will have these antibodies which can quickly come into action and protect us from developing severe symptoms and severe disease. So how good are the virus? The protection can be very high, especially for Pfizer, but even for AstraZeneca, the protection is quite high. But I think it's important to remember in terms of protecting ourselves against severe disease and death, both vaccines work pretty well, very, very high protection in that sense. So because of the initial trigger, the vaccine actually, it tries to mimic the infection, right? So that's why you get this experience where you have symptoms, which is fairly similar to the actual disease. Your immune system is reacting to the antigen that has been introduced into your body. So it's developing all these antibodies. So having side effects is.
Oops. All right, there's a buffer there.
Okay. Right. My connection is unstable. God, who's going on the internet? So okay, now is it clear? All right.
Yeah.
So, but if you do have any unusual symptoms or if the symptoms are prolonged, then it is advisable to seek medical attention. You can also report these incidents because it's really important for all of us to, these are new vaccines, a lot of fear in them. So it's always really, really important to feedback to us so that we will know how these vaccines are working in the real world.
Okay, so Dr. Sharifah, can you explain to our viewers how come different people react differently to the same vaccine? So this is from personal experience. My husband and I received the Astra vaccination on the same day and within minutes of each other. While I only had intramuscular soreness at the injection site, the next day he developed a fever of 39 degrees, body aches severe enough to keep him in bed for a day and a half, and a pain in the arm that persisted for close to 5 days. So why the difference? I know it's not because women are tougher, right?
Well, even though I think women are tougher,
yeah.
There's no clinical data to support this when it comes to vaccination. In fact, for myself, I was a bit under the weather for a few days. I got the Pfizer vaccine. My husband got the AstraZeneca from UM, and he was quite okay with it. My mom just got her Pfizer last week, and she's been pretty good with it in terms of side effects. So I think the common side effects that we see, the usual things that you hear about: pain in the arm, redness and swelling in the arm, fatigue, headache, muscle pain, a bit of chills and fever sometimes, and a bit of nausea. So these are quite common. Don't worry about it. And in some cases, when you take the second dose, it may be a bit more pronounced compared to the first dose. It's still very unclear why some people have more side effects compared to others. There has been some observation, as I mentioned, that the older you are, probably you're less likely to have side effects. So maybe it's because my husband is older than me. But the exact reason why is still very unclear. It could be because younger people have immune system, react more strongly compared to the older people. And also, we need to remember not everyone is the same, regardless of whether you're old or young or a man or a woman. Every person's immune system has its own, specific ways of responding to the vaccine. And also, other than, the allergy information, there's no other data that says that there's any difference between one person to the other. But one thing I would like to say that, even if you didn't have any reaction or your reaction was so mild, don't worry, don't think that my immune system is not working. I didn't have any, I'm not building any antibodies or anything, because most studies for the vaccines, they showed that, in terms of the immune response, the immunogenicity is quite good in all age groups.
Okay, so can I ask if there are different side effects from different vaccines? Like, would someone have a different collection of side effects from the Pfizer and a different one from the Astra, or is it generally all the same?
So the ones that I mentioned earlier, that's the sort of the general side effects for all vaccines. Pfizer, probably there's a bit more allergic reactions, even the mild ones, not talking about anaphylactic reaction, but the mild, urticaria, rash. I think we do see a little bit more in people who take the Pfizer vaccine compared to maybe the AstraZeneca or the Sinovac vaccine. But we will talk about the more severe side effects, I suppose, later on, just to code it a little bit more on thrombosis and so on.
Okay, cool. So just so this is made clear, Dr. Jem, this one is for you. The social media community have noticed that you have rallied behind the Astra vaccine, possibly because you wanted the weight of your not unconsiderable social media following to understand that you got the how do I put this safely, that you were behind the safety and efficacy of the AstraZeneca vaccine, so just because one brand of vaccine seems to have more side effects than another does not make one vaccine better than another, does it, Dr. Jem?
No. I think as Prof. Sharifah has mentioned earlier, our reactions towards the vaccine are very variable, right? And also when we look at vaccines, remember this: no vaccine that has basically NPRA, which is our national pharmaceutical regulatory agency, which is very, very, very strict compared to any other agency in the world, will never endorse or approve a vaccine if it's not safe or efficacious. WHO has set some guidelines. For example, you must have an efficacy of more than 50% for you to be able to roll out a vaccine. And I just want to say this, and many people don't question other vaccines. We've had so many vaccines in our arms, right? And for those who go for Hajj or Umrah, for example, you get meningococcal vaccine, you get, all this stuff, right? And then we have the flu vaccines as well. And their efficacy actually is not very high. It's probably about 60%, but no one questions that, right? And here we have Pfizer like 95% and AstraZeneca, everyone has good efficacy and everyone is now questioning. So I think there's a little bit of probably people are ignorant about the efficacy of previous vaccines. So they think that, they must get 100%. That's one. The second thing is that right now, the priority is to make sure people don't get sick with COVID. Because when you get side effects of the vaccine, it's nothing compared to getting full-blown COVID, right? You might die with a COVID. You might have difficulties breathing, you might have to be ventilated in ICU, you will have long-term effects like, long COVID. We've talked about this before: pain, neurological problems, breathlessness, and so forth. So the risk of getting a disease like COVID is so much higher than.
Okay, transmission problems again. No worries, we will get Dr. Jamila back online.
Karen, if I may, I'm going to show the stats in two graphs, in two posters that MKN has produced for AstraZeneca, so that people have have an idea.
Yeah, fantastic, thank you.
So keep talking. I'll just. I'm not the best with navigating these things. So
no worries at all. So, Dr. Sharifah, I love what you and Dr. Jim have said about the importance of being vaccinated. The fact that any vaccine right now is better than no vaccine at all. A minimal protection is better than no protection whatsoever, So as Professor Adiba is starting with this, I would like to share that Henri went ahead with the AstraZeneca vaccine just this Tuesday. And because she and I are friends, I read the very moving commentary on her decision to take the Astra. Henri, can you share this process with our viewers, please?
Yes, happy to, Karen. Thank you so much. Yeah, it was actually like I said in my post. It was a very difficult decision. I think it was made difficult, unfortunately. I think by a lot of questioning from a lot of parties, especially because, as you note, my appointment was on the 18th. And on the 17th, there was an announcement to say that basically that mentioned AstraZeneca has to, for all individual who decides, especially breastfeeding mothers who decide to take AstraZeneca, that they will have to go for like a medical consultation before they can actually proceed with, and it's an individual choice as well. So I think that unfortunately make the circumstance a difficult circumstance even more harder for us. I think initially when we went ahead, when the offer of AstraZeneca came about, my husband and I, it was a very quick decision. It was like, oh, it's out and we should get it, so immediately we signed on and we both got our dates. And then as it got closer, like I said, on the 17th, when the announcements was made, suddenly I was kind of questioning whether or not to proceed. But of course, before that, I actually asked my doctor, my gynecologist, my pediatrician. I actually asked for anyone that I know who has some kind of medical background. We actually seeked out for advice, and I think, unfortunately, 3 out of 4 of those people that I reached out to, they actually stood by the fact that, okay, I think you should get a consultation and it's a personal choice whether or not you should go ahead, because since you're fully breastfeeding, like mentioned, my baby is she just turned 8 months yesterday. But yeah, so which it wasn't really much. Unfortunately, they didn't give me the assurance. The only doctor that I had was my gynecologist, and she actually she was the only one that said, you know what? She said, any vaccination against COVID that you can get, the fastest vaccination you can get is the safest at this point. That's what she said. So basically, it aligns with what all of you had said. It's the fact that she said the side effects are the side effects, right? It's not going to be as bad as the fact that if you get COVID. So I went in with that mentality, and I mean, I was very sure that I was going to still take it, or at least that's what I thought. But when I was there and I was getting my medical consultation, and I brought up my concern to the fact that I am fully breastfeeding, and obviously my baby being at 8 months, under 1, she is highly dependent on the breast milk. And the medical consultant that I got, she was very kind and she was very understanding. We sat there for a really long time, and she actually gave me all of the what are the probability, why is this a concern, and she set me through all the facts of why was this mentioned, and what are some of the other breastfeeding mother's decision. She understand why it was difficult for me, because my baby is still under 1 year old, and then she's fully breastfed. But a lot of the other breastfeeding mothers, she said that because they're a little bit older, then it might be easier, and they would straight away say, okay, let's go for it, So it was tough sitting in front of her and her not being able to kind of tell me. I mean, I wish she could just say, it's good, you're gonna be fine, and go ahead. But I understand why she has to say what she said, because she's not supposed to sway me one way or the other, and the decision is up to me. And I think what really kind of pushed me to say I'm gonna do it is because we sat there in silence for quite a while, and she knows I was kind of thinking about it, and then she just went, the cases are really bad right now. And when she said that, I just realized that, okay, I need to do this now. because I don't know. I don't know if I'm exposed. I don't know if, you know, if I will be exposed. And I feel like then the safest way to kind of protect myself, to protect my family, is to get it lah, and hope for the best. And so I think that was the reason why, you know, it kind of pushed me to say, okay lah, I think I will take whatever risk that comes with the vaccination, whatever that may or may not happen, because the main thing is I need to protect myself against COVID, and I need to protect my family against COVID. And I feel like getting the vaccination is my best chance of doing it lah, you know. So and that's why I decided to go ahead with it.
That was a very, very brave thing to do, and I'm really happy that you listened to the science behind it. You know, your concerns about breastfeeding mothers and the vaccine is a very valid one. I know there've been very little conclusive findings on this because it's so new to all of us, experts and non-experts alike. You know, we're all learning together day by day. But can I ask Dr. Sharifah, Professor Adiba, and then Dr. Jim, as a gynecologist, to weigh on this, please, to speak about possible side effects for breastfeeding mothers and perhaps women who are pregnant?
Okay. I mean, when we started our vaccination for the frontliners, we were also in a dilemma because at that first 1 or 2 weeks, there was still not very clear instructions on whether we could give it to pregnant women or not. I think the main issue is that in most of the clinical trials, the pregnant women and the lactating women, breastfeeding women were not included. So when they're not included, as you know, as scientists, as doctors, we don't have the figures, you know, we don't have the black and white, whether it's safe or not for them. But saying that, you know, the UK, the US, Israel, many countries have vaccinated millions of people by the time we started our vaccination. And in those places, there's always a surveillance, there's always a post-vaccination surveillance, including looking into pregnant women and lactating women who got the vaccination. And so far, there haven't been any, you know, red flag signals to show that it's dangerous towards the pregnancy, towards pregnant women, or towards their babies. So with that, within a week, the government came out with a directive saying that, especially with the support of the Gynecology Society, saying that you know, certain women could go for the vaccination if the risk of COVID outweighs the benefit of so the benefit of vaccination outweighs the risk of vaccinating in pregnancy and so on. So we were quite happy to give our ladies the Pfizer vaccine. Then when AstraZeneca came aboard and then that announcement came about, so it was just another dilemma again. I think it's the same thing, you know, there's no studies with it. I think AstraZeneca is still collecting the data, and I'm sure sooner or later we will also come out with, they will also come out with a directive, like a guidance as to AstraZeneca vaccination in pregnancies.
All right, fantastic. Thank you, Dr. Sharifah. Professor Adiba, weigh in on this, please.
No, I don't have much more to add except to say that, you know, what Erin has described is, you know, really what we hope the interaction between healthcare providers and patients is all about. It's you know, in modern medicine, we call it shared decision making, which means, you know, we as healthcare professionals give you the facts, give you, you know, the statistics, the pros and cons, and you as the patient, after all, it's your body, make that decision, that informed decision with the knowledge that we have shared with you, and together, you know, kind of balance the pros and cons. So I thought that was a really perfect example of shared decision making, which is what modern medicine should be all about. It's no more, you know, doctor knows best. Well, doctors still know best, I think. but you know what I mean? That yeah, it's the risk and benefits that each individual weighs up.
Okay.
Can I just chip in? It's interesting when the phase 1 was frontliners. So these are supposed to be healthcare workers, right? So it was interesting, the kind of conversations that we had even with them with regards to the risk and benefit of vaccinating pregnant women. And it's the same kind of conversation that we would have with the public as well. The same concerns are still there. But I suppose in frontliners, the risk was felt a little bit more because they were like in the hospital, lots of cases. They wanted to protect themselves, but they wanted that reassurance that, the pregnancies will be fine, the babies will be fine, and so on. So I think it's a valid concern. Everyone will have it regardless of whether you are in the health sector or the general public. And having that shared decision, that shared conversation, like what Prof. Adiba said and how you've described it, Anri, it was excellent, and I hope most pregnant women and breastfeeding women will be able to have that.
All right, we have 450 viewers currently engaging with us. The questions are hard and fast. I'm going to try to juggle them a little bit. Dr. Jim, we have a whole host of gynecological questions. I'm going to target these to you, if that's all right. So question 1, Henri, one of our viewers on Facebook wants to know if you continue to breastfeed after taking the Astra vaccine.
Yes, I continued. I actually asked my gynecologist, the one that encouraged me to take it as well, and then she said that there's no reason. She actually quoted a lot of international studies, and then to me, and then she said that there's no reason for me to stop breastfeeding. So I have continued since. Actually, I'm still breastfeeding. So
that's awesome. Dr. Jim, can you weigh in on that one?
Yeah. So
Oh gosh, Dr. Jim, I'm sorry, your connection is poor. Don't worry, we'll come back to you. Do you want to try this again?
Yeah, I'm having really a nightmare with internet connection right now. So yeah, can you hear me now?
Yes, we can, Dr. Jim. Go ahead.
No, now we can't.
Can you hear me?
Now we can't.
Yeah, we can't now, Dr. Jim. This sounds like a haunted seance. Can you hear me? Can you hear me? Okay, well, Dr. Jim tries to reconnect. Prof. Adiba, can you share this with us all and explain what this means exactly?
So, Farida, do you want to do this? You are muted. Farida.
Okay, I think there was also a question about, why in the UK only below 60 and some countries below 40s were given AstraZeneca and whether it's safe. So I think when you look at, we always talk about weighing out the benefits versus the risk of vaccination. So the first graph here tells you the potential benefits in terms of how many ICU admissions you are able to prevent in different age groups compared to the potential risk of blood clots with low platelets in those particular age groups as well. So this is data specific for Malaysia. So the data that we've been seeing prior to this has been like from the UK, the US, and so on, where the cases of COVID is slightly different from what's happening to our country. So with the current number of cases, for example, the 20 to 29-year-old, you can see that the benefit of giving the vaccine will prevent about just over 2 ICU admissions, but the risk of thrombosis in this group almost reaches 2. So you can say that, the risk and the benefit sort of, it is fairly equal. So people in that age group may want to think about whether they should go for the AstraZeneca or not, because if they take it, the benefit of vaccination is preventing them from getting admitted to ICU. It's not very high compared to them getting a blood clot. But if you compare that to someone, say, in the 50-year-old age group, So if they take the vaccine, you are preventing up to 34 ICU admission every 100,000 people who get vaccinated. But the risk of them getting thrombosis is very low, only 1 in 100,000. So in this case, you would say that, you know, the benefits of going for AstraZeneca vaccination for that age group far outweighs the potential risk of getting a thrombosis. So I think this kind of data is very, very important for us healthcare providers to present to our potential vaccinees who come for vaccination for AstraZeneca, so that they themselves can weigh the pros and cons of vaccination. But saying that, you know, we need to also be aware that, you know, this is for the average 20 to 29-year-old. When you have a comorbid, if you have other medical illness, and obviously your benefit for preventing ICU admission goes up. If you are in a scenario where the transmission of COVID is very high, again, the potential benefits of preventing ICU admissions is also very, very high as well. But for the average young person, the benefit may not be as much compared to the risk of thrombosis, and when you compare to the older population. So that's one. The other thing to bear in mind is when the UK and all these other countries, when they put the age limit for AstraZeneca, they were in a scenario where they had access to other vaccines. So, you know, one may argue that in Malaysia, the access is not that great at the moment because we're waiting for the supplies to come in. So going back to the fact that, you know, what's the best vaccine? Probably the best vaccine is the first one that you can get hold of. So weighing out those benefits and potential risk of vaccination, and also the availability of vaccines.
Right. That's very, very succinct. Thank you, Dr. Sharifah. I love the fact that you can simplify this for us. All right, Dr. Jamila, oh my goodness. There are so many lactation and pregnancy questions right now for you.
Yeah.
Okay, so can you hear us?
Yeah, it's kind of funny. I feel like I'm sitting on my staircase with my phone now, trying to connect to all of you. So I'm really sorry about this. So there's been great questions. So let me try and speak quickly before my internet goes off again. First of all, Henri, well done. I think your gynecologist is a good one and gave you a very good advice. And to add on to what Prof. Sharifah said, when the vaccine was being manufactured, again, you know, when they were rolling out in the trials, I think they didn't think through about pregnancy. But what happened was with the Pfizer rollout, at least, a lot of the people that they administered to the vaccine, a significant number, I don't remember the exact numbers now, but Prof. Adiba may remember, were actually pregnant without knowing it. And they followed them through, and the pregnancies had good outcomes. And interestingly now also they're hearing that, we're hearing now evidence that the antibody production in breast milk is also very, very encouraging, which means that if the woman has been vaccinated and she's lactating, the antibodies that she produces is passed on to her baby. So I think it's a good thing, right? Now with AstraZeneca, the studies have not been as wide as Pfizer, but in the UK as well, they have been using AstraZeneca quite broadly among women. Now, interestingly, just as a fact to consider, when the Ebola vaccine was rolled out, they actually use something called the vector vaccine, very similar platform to AstraZeneca, and they found that it was useful in pregnancy. So we can extrapolate from that it is a good enough vaccine for pregnancy. So I think the bottom line is this: if you're pregnant, we will pivot towards Pfizer. When there is enough Pfizer stock, obviously, we want to reserve for pregnant women, Pfizer. For lactation, if we can give Pfizer, we'll give Pfizer. But when there's a shortage, if there's AstraZeneca, we give the AstraZeneca vaccine. Again, for those reasons that it's better to get COVID vaccine than COVID-19. And right now we're in discussions whether, when our Pfizer volumes come up, that you actually then consider giving the second dose Pfizer, even if you had first dose of AstraZeneca. So these are all in discussion format, because right now, even in the Western countries, they are looking at mixed dosing. That means if you have one AZ, one Pfizer, one Sinovac, one Pfizer. So there's a lot of research ongoing to look at, what might be the benefits or any potential reduction in efficacy if you actually have two vaccines that are different. So just to share with you, this is ongoing research, right? Now, the question then is that, what do we do now? So on a practical and pragmatic sense, what we're going to start to do is, when you have in the MySejahtera, you have to declare, right, whether you're pregnant and so forth. There are questions there. Now, there is also a questionnaire that is reserved for 3 particular groups that have to be watched for. 1 is people with severe allergies. 2, people who are immunocompromised, either they have some disease or are on chemotherapy that reduces their immunity. And 3, people who are on blood thinners. Now, these 3 particular groups, you need to get a certification from your doctor whether you can be vaccinated. Number 1, they may have to do a blood test on you. Number 2, where you are going to be vaccinated. It could be in a hospital setting or in a vaccination center. So we want to do the same now for pregnancy, because the added challenge with pregnancy is the vaccination period is between your 14th to 33rd week of pregnancy. So we got to time your vaccination so that you get your vaccination between 14 to 33 weeks of pregnancy. So this has been already discussed. It's approved. So some announcement will be made on the particular ways we can do it. But please, whatever it is, please consider taking the vaccine for yourself, because pregnancy itself is a situation where your immunity is actually lower than other people, and that you may be more susceptible to COVID-19. And in addition, pregnant women who have, say, gestational diabetes or high blood pressure or who are obese, they have even higher risk. So we got to make sure that we protect the woman who's pregnant, because in doing so, you protect her from severe disease and also protect her unborn infant or unborn baby, from being very ill.
That makes a lot of sense, Dr. Jim. Another question. Some women I know experienced some disruptions to their menstrual cycle when they took the vaccine. Any thoughts, Dr. Jim?
So far, I have not seen any scientific research to show that menstrual cycles are disrupted. But I also want to say that getting a vaccine can be a very anxious, can increase the anxiety levels of many women, right? So anxiety itself can disrupt your menstrual cycles. So I think if I want to say there's a direct correlation, I doubt it. There's any direct correlation. But if the woman is particularly anxious and worried and so forth, that could itself disrupt menstrual cycles.
All right. Dr. Jamila, another question. I'm fully breastfeeding my 7-month-old baby who has congenital heart disease. Is it advisable for me to take the AstraZeneca vaccine? If not, how can I take the Pfizer, since we are not given any choice?
Yeah, so I think that if you are breastfeeding, and I'm sorry to hear your child has a congenital heart disease, but most of them are treatable. So I hope that you have a good pediatric cardiologist looking after your baby. I think that in your case, you can always write in, to the CITF, your vaccinecovid.gov.my, and make the case. What I'm trying to say to you is now we're going to pivot towards Pfizer, right? Which means that if you're pregnant, we will definitely give you only Pfizer. You're breastfeeding, we try to give you Pfizer only. Or if you've had the first dose of AstraZeneca, if the research says that we can mix, then we will mix.
All right. Dr. Sharifah, Henri is looking very, very pensive right now. On the heels of what Dr. Jim has just said, we note again that there is no wrong vaccine. There is just something that is perhaps a little bit more suitable to some other people at different phases of their lives. But just, Dr. Sharifah, just give Henri and other women who are breastfeeding, who have taken the Astra, some pupuk semangat, as to their choice, please.
I mean, I feel again, like what Prof. Jem was saying just now, Astra has been used so widely in the UK, especially, and they've vaccinated millions of people. And even if the study itself did not include pregnant women and lactating women, some became pregnant as they went along during the pregnancy and during the general rollout. Some were pregnant when they were given the AstraZeneca, and I think, especially in the Western countries, I think we can rely quite well with their post-vaccination surveillance data, and I think we can safely say that we have not seen any real red flags to say AstraZeneca will harm the baby or harm the pregnant woman or the pregnancy itself. I think it's just because Pfizer has a bit more data out there compared to AstraZeneca. That's why we're just saying if we can give Pfizer, we give the Pfizer, but it doesn't mean that, oh, you've taken Astra, therefore you're in trouble, So I don't think pregnant women, breastfeeding women who have taken the AstraZeneca should worry too much. It should be fine.
If I can quickly jump in here, I think it's worth reminding our viewers that just as with those over 60, diabetics, obese, heart conditions, pregnancy also increases the risk of getting severe COVID. And I think there was one study that also showed there is a risk of premature delivery. Yeah. So, so hence, I think pregnancy should belong in the group of get your vaccination ASAP.
Okay, point taken, Professor Adiba. Henri, at any time in the process of waiting for your vaccination, because you did register online for Astra, right? Did you feel that you wanted to say you changed your mind and you wanted to wait? And if you did feel that, why did you finally decide to get vaccinated with Astra?
I did, definitely. I think on the 17th, as the announcement was made, because prior to the 17th, I think most of the literature that we saw regarding the vaccination, especially on AstraZeneca, it says that it's suitable for lactating mothers, which then that was what I kind of went on with. And like I said, because I actually consulted like my pediatrician, my gynecologist, and most of them said, yeah, it should be fine. It should be fine to go ahead. And, again, the benefit definitely outweighs like whatever potential possible side effects. So, but then when the 17th, when the announcement was made and said that, it needs to be reviewed if you're lactating mother in terms of AZ. And I know for a fact that, I didn't know any other way to get Pfizer. If I could, obviously I would request for it, but I am not in that, so the only option for me is either I take the AZ or I don't take it at all. So I had to make a decision on whether or not. So the option is, do I take it now or do I wait till whenever it's my turn for the government rollout and hope that I will get Pfizer, I suppose, I think, because I'm not sure whether or not I have the right to request for which vaccine that I'm supposed to get. So kind of weighing the time, and then because now it's quite crucial, like I said, because the cases are very bad, and I because I'm a lecturer and I do stand in front of students, and and I don't know what I bring home to my baby. I had to make a decision, and I guess it's not an easy decision, because like I said, because there's just not enough data, and if my friends, and I do have many friends who are also new mothers, and they do come and ask me, they like, especially after the post and I mentioned that I took AZ, they asked me like, so do you continue breastfeeding, and is it safe? And I told them my exact process. I said, I feel like it's a risk, like, because we just don't have data, and I'm not the person to provide those data. And I said, I just base it on the fact that it's better than getting COVID lah, you know, I suppose. And I'm hoping that, you know, nothing's going to harm. But bottom line is, I don't want anything to happen to my baby. I don't want the fact that I'm still breastfeeding and she's fully dependent on my breast milk, and then something could happen to her. You know, that's my only thing. You know, that's my biggest concern. And yeah, and now that I've taken it, I'm just, I don't know, I'm just hoping that, yeah, it will end well for all of us. That's my hope.
Andre, I think just like the reason why Tan Sri Jamila and Professor Adiba piloted this series was because we wanted to make sure that people were getting the right information, as much information as was possible, and verified information from a true source, which is why we have people like Dr. Sharifah online with us every single week, you know. So trust the science and trust the scientists and trust your doctors. One more question, Andre. As a married woman with a very hands-on co-parent, did you discuss the vaccination with your husband, Michael? And I know he received his vaccination before you. Was that planned?
Yeah, no, actually, it kind of worked out for us because we were both kind of signing on at the same time. Actually, he managed to get a date before me, and then he just kind of quickly go try and get it, and then I was like, okay. Then he got an earlier date. We wanted to kind of match our date so that we can kind of hit together, but it worked out because he was very much affected by the vaccine. He was down, out. He is one of the healthiest person I know, and he was like in bed. He was bedridden for like 2 days. I think he couldn't move, and I was anticipating that would happen to me, but actually I was fine. And also, like what Dr. Sharifah has actually said earlier, when I didn't get the effects, I actually got nervous. I'm like, was I properly vaccinated? Is it me? Is my body not fighting against the you know, is it not reacting properly? Because I felt fine. Like aside from obviously soreness on my arm and a little bit of a headache, and I was like, okay, I'm functioning like a normal human being. But he was completely out for like 2 days, and I was like, okay, I hope it worked, and I hope everything's fine. And my girlfriend, who is also a breastfeeding mother, also first-time mother, she vaccinated the same day. She came to me and she asked me, how are you feeling? I'm like, I'm fine. She's like, I'm fine too. Is that okay? I guess we're worried either way, but I think it's as like parents, as new parents, I think it's a difficult thing to have to navigate around these circumstances. And so I understand a lot of the concerns from people like myself who doesn't understand the science behind vaccination because it's so new. And it's not like we have data that has been collected since forever. You're talking about data that could be months old, you know? And so I understand, to a certain extent, I understand the hesitance, but also if there's anything, I feel like the science is there. I mean, the facts are the facts. I feel like you can't fight with the facts. Is that the numbers are very bad and people are getting affected, and these are very real, I feel. And I feel like of course, if we have a choice, you know, that's the deliberation, right? But then if you're looking at the numbers right now, do we really have a choice? That's what we think.
Very, very well said. Absolutely. Thank you. Dr. Jamila, if you're with us, a question. Will priority be given to those of the younger population, 40 years and below, with comorbidities? Is there any brand of vaccines to be avoided for people with allergies and hormone issues and issues relating to hormonal problems?
Yeah, on comorbidities, obviously anyone with comorbidities becomes higher risk. And, you know, when you declare in your vaccination that you want to take the vaccination, please put that very clearly. Let me be just very frank. Our vaccines have been trickling in because, you know, we get a certain amount every month and every week, but they're ramping up now. So we're going to get much more from June. So
right now, the priority, as you would have seen, even with AZ and the PIC, which is the immunization program, which involves Pfizer and Sinovac, the priority is trying to get the ones who are older, 60 years old, and those with comorbidities vaccinated. So that hopefully will be done quickly, and we ramp up what we call phase 3, which is open to everyone, and get as many people vaccinated as possible. So I think yes, the short answer is yes. Anyone with comorbidities really must be prioritized, but also depends on the comorbidities, right? Because some are more dangerous than others. The obesity, hypertension, diabetes, these are really, really problematic.
Okay.
On the other question, I think, what was the other question, Karen?
The other question.
The one about those with thalassemia and
yes,
all that, right? That's got nothing to do. I think that's not to be, you can take the vaccine if you have that. I mentioned again, 3 groups that have to take extra caution. 1, on blood thinners. Number 2, who are immunosuppressed. And number 3, those who are having severe allergies that have anaphylactic reactions.
Okay. So any,
if I may, Karen, just to expand on what Tan Sri just said about those 3 groups, I think the immunosuppressed, the issues are slightly different from those with allergies. Those with allergies, obviously, we're very worried about side effects. But those who are immunosuppressed, actually, we're worried that they may not respond as well to the vaccine and get the maximal effect of the vaccine, depending on the timing of, say, their chemotherapy. And so that's why it's something that they need to discuss with the oncologist. In fact, like everyone else, they should be vaccinated as soon as possible, but taking into account if they are currently receiving chemotherapy or radiotherapy, the timing between the cycles of chemotherapy and radiotherapy with the vaccination. So it's not because they're going to they are at risk of getting more side effects. It's more on whether, when would be the maximal time for them to get the best outcome from the vaccine, because now studies are starting to come out to show that those who, for instance, patients who've received kidney transplant or are on dialysis may not respond as well to the vaccine in terms of the immune response. So those are the issues that we need to weigh up, not to be confused with the side effects and reactions.
Okay, that was very clear. Thank you so much, Prof. Andre, is little baby Isabella with you? Like, does she get her debut today?
Yes, sorry, because my husband needs to do something, so she's here with me on my lap. Yeah. Hi, this is my daughter Isabella. This is the baby that we're concerned with.
Oh, welcome to the show, Isabella. All right, ladies, we have got a lot of viewers asking a lot of questions. Viewers, I'm addressing you. Your questions are onboarded. If we cannot answer them within the session, they will appear in our other sessions. But this time, I'm going to do a quick fire round, and I'm just going to open this up to any of the doctors who want to answer this, all right? So any concerns for psoriasis patients with taking the vaccine? Is there a particular brand of vaccine which is better or worse? Go, ladies.
No.
No,
There's quite a few questions here on specific diseases. I think it's going to take time for us to answer every single disease. So I think we should stick to what Tan Sri had said, those conditions that she described, and everyone else, largely, it should be safe to be vaccinated.
Okay, so you hear it.
Is that a fair summary, ladies? Please.
I think some people on psoriasis are on immunosuppressants, so just be a bit careful with diseases where you're
fair enough.
That's all.
Okay.
Yeah.
So,
Karen?
Yes.
Karen, I have a suggestion.
Sure.
Since my internet is so crap today, the questions will be on
It's more
Facebook.
on Facebook.
And
Tansri.
And I think all of us will make a real effort to get your questions answered on Facebook. All right.
All right. Sounds like a plan. So viewers, bear with us. We will answer questions on the chat as we go along. The most important questions for the topic today, we will address now. So things about specific conditions, illnesses, unless you fall into those three groups as mentioned by our specialists, the blanket answer is it's okay, go ahead, get vaccinated. All right. So we have also a viewer saying, can I suggest that the vaccine registration form add a column for ladies to update their status of pregnancy and breastfeeding? If you look at your MySejahtera, they do ask you if you are pregnant. I think that will come. Dr. Jim, do you have insight on this one?
Yes, we're going to do better than that. We're going to have a special dedicated section for pregnant women and lactating women, because we need to start figuring out, and very importantly, you need to work with your gynecologist on that timing of your first and second dose, because it has to be between 14 to 33 weeks. Anyone working on the MySejahtera app will have no clue how to calculate your timing of your vaccination. So please talk to your doctor, and and will help. I'm not going to commit here, but I'm going to get into a lot of trouble. But I think we are thinking also of a dedicated hotline for pregnancy and lactation, and guess who might be manning this hotline. But I think it's important. I feel very strongly as someone in the field that women should have a space to ask these questions, or we'll produce some very clear FAQs as well for you.
Oh, that sounds wonderful. Thank you, Dr. Jim. And as usual, you've bitten off a lot more than you should, but thank you. Dr. Sharifah, any comments on the efficacy of Sinovac compared to Pfizer and Astra? A lot of news saying that it has less efficacy, only 50%. Is it true?
So honestly, we don't have much data on Sinovac compared to Pfizer, compared to AstraZeneca, but the data is there. I think when it comes to vaccination in the general population, younger population, the efficacy, is okay. It's above 50% as required, maybe up to 80-90% in that population. But there were some studies in older people with more comorbidities. The efficacy may not be as high as that. But it was still above 50%. But the crux of the matter is how well did it protect them from getting severe disease? And I would say that, it did quite well, about 70-80% protecting against severe disease. And that's what we want to see. So, if you had a choice of what to take, then obviously you would want the ones with the best efficacy and whatnot. But at the end of the day, when you're aiming for mass vaccination ASAP, whatever that you have, please go for it. I'm not quite sure, maybe Tan Sri Jamila can highlight here exactly who's getting the Sinovac, but I do see people who are being vaccinated in the community, in GPs are getting Sinovac. So I assume they are probably, younger people with less comorbidities. In the frontline setting, we are giving it to our support staff rather than those who are really in the frontliners. So I think that's good protection. At one point, we were like very hesitant to give Sinovac. We were like, oh, I don't want to give Sinovac. But then we thought about it. We said, better Sinovac than nothing at all, even for our clinics, because at the end of the day, they were in the clinical setting, they needed to be protected. So we went ahead with Sinovac for our support staff.
Yeah, just to respond very quickly, Sharifah, you're spot on. Sinovac is being rolled out now for frontliners who are not particularly the health frontliners, economic frontliners and all that. The basic thing is that any vaccine is better than no vaccine. And I think the recent results and research have shown that Sinovac is really quite effective. And these are real world data. I don't want to risk saying absolutely the wrong diplomatic thing, but Western vaccines, they're very keen to publish in Western journals. But I think for Asian vaccines, they're more conservative about that. But I think what we can also look at is real world data. There are millions of Sinovac, Sinopharm being administered in Turkey, in South America, in UAE, and so on and so forth. WHO, for example, has already approved Sinopharm. It is now in the process of looking at Sinovac, CanSino. So, you know, if WHO says it's good enough, it's good enough, right? I think we've got to take that attitude. And surprisingly, I must say, because Sinovac is from a platform that is a conventional platform, more people are demanding Sinovac because there are less side effects in a normal conventional platform that they're used to, right? So I think the tables turn on and off.
I don't know how true it is, but I think some people demand Sinovac because they want to go to China once the pandemic is off. But that's just a separate matter.
Yeah, I think you're right. I mean, but it's not true. We verified with the Chinese ambassador here, and it is not true that you only can go to China if you have Sinovac. But people just want Sinovac because they like the platform that it uses, right? But and then, you know, we have to see what Europe and does, whether they start being finicky about what vaccine you have. But I think the reality is, forget about the travel. We're not going to be traveling for another year. So, you know, get yourself protected from COVID-19 and your family and your loved ones.
Oh, excellent. Excellent advice. Okay, Dr. Sharifah, most of the side effects we have heard about follow similar patterns: flu-like symptoms, aches at injection site, tiredness. Are there any less common side effects to both the Pfizer and Astra vaccines?
So in terms of Pfizer, the one more severe side effect, if you like, which is very rare, would be the anaphylactic reaction. So when we started off with Pfizer, that was the one that we were most worried about. But in terms of how many cases are reported, it's about 4 to 11 cases per million people vaccinated. So you can see the numbers are quite small, very, very small. And usually if it does happen, it would happen within the first 15 minutes of getting vaccinated. So, you know, those who've gone through vaccination will know that we will observe you for at least 15 minutes. And for some people, we will observe you for 30 minutes. And you also have that post-vaccination avenue on the MySejahtera, where you can also report if you do have any allergic reaction. So, I mean, who gets this? Usually people who have previous allergic reaction may have to be a little bit more careful. They may be a little bit more prone to getting anaphylactic, but anaphylactic is very, very rare as a whole. And it is very severe and life-threatening, which is why it's important to be observed properly post-vaccination, but it's very rare. The other rare, very rare side effect, but equally worrying, is this thrombosis. So vaccine-induced immune thrombotic thrombocytopenia. So where you get all these scare of blood clots. So again, you know, people started seeing this once the vaccines were rolled out in the UK and the Europe. So if you look at the overall risk, you know, it's about 4 in 1 million again. But looking back at the graph that we showed you earlier, you can see that the younger you are, the risk is a little bit higher, but it's only like 2 in 100,000. So, you know, my son wanted to go for the AZ, and so we were talking about this, and we were saying, you know, for me, 2 in 100 is like, wow, I'm so worried, my son, you know, but for him, it's like 150,000, that's okay, you know. So it's about risk benefit and how you feel, how quickly you want to get vaccinated and all that. So it's still a very rare side effect, though the guidelines do say that, you know, we have to probably be a little bit careful, but for people who had previous history of, you know, this thing called cerebral venous sinus thrombosis, where you have this thrombosis in one of the blood vessels in the brain, not similar to strokes, or splenic vein thrombosis, where one of the veins within the abdomen gets thrombosis. And, you know, I think when you go through your AZ consent area, they will explain this to you and what are the symptoms that you should be looking out for to point out maybe there's thrombosis happening. So very, very rare. Yes, quite worrying, but very, very rare.
Okay. So as a bit of a fatalist, I want to know how bad side effects really can get. I mean, have any one of your doctors or volunteer vaccinators, have they had to personally deal with someone with serious side effects?
So, sorry.
No, go ahead, Prof.
Just sharing some experience for us in UMMC. So when we did the phase 1 vaccination with frontliners, it was still very new for us. We didn't know what to expect. We hear about this anaphylactic kind of reaction. We were so worried, and we were vaccinating a younger population. As I said earlier, the younger population, maybe their immune response is much quicker and greater than the older population, and therefore we did see quite a lot of people who had some complaints. The majority were fine. I think my colleague, Dr. Nabila, she was looking after our observation area. And the first week was, a lot of palpitations for us as well, because we were not sure what to expect. But, we had very, very few who had real anaphylaxis, probably less than 5. We had some with slightly unusual symptoms like this lightheadedness. They felt a bit empty, palpitations and vomiting as well. But all resolved with treatment. Just needed a little bit more observation and treatment. But at the same time, I wonder if anxiety played a part as well. Everybody was worried first time going for vaccination, Pfizer vaccination, you're hearing about anaphylaxis, and probably that played a role as well. But generally, there was some allergic reaction, which was very easily treated with some antihistamines. That symptom of the Pfizer vaccines. Yeah.
If I can share my experience, I've been in the World Trade Center since it started. We're not seeing so many of these serious side effects. There have been a couple of allergic reactions that resolve very well with, some hydrocortisone and one anaphylactic-like, a couple of anaphylactic-like reactions, but also responded very well to epinephrine. And yeah, so it's been okay. And we are seeing a lot of anxious people, anxiety attacks, some elevated blood pressure that resolves as well. One thing good that we've done in the World Trade Center is we have a calm room that when we see someone really super anxious, we bring them into that room, and then they have quite, a very quiet room. And after they're vaccinated, they're put immediately into the kind of the sick bay to be observed. I think Karen, your parents had that experience as well. But I want to jump in as well about young people in AZ. Younger people, when we counsel them, they are very pragmatic. They say, we want to get it. We don't want to fall sick. We know that, and this is a fact, the majority of people who are asymptomatic in spreading the disease are 28 to 40 years of age. And sadly, right now, they are also falling very sick. So I think that my 2 sons who are below 30 went for AZ. One had absolutely no side effects and the other one had a little bit of fever. So I respect them for making that decision on their own.
All right, that's awesome. So generally, if a really bad reaction were to occur, such as a blood clot, can this be spotted at the vaccination center, and what are the signs?
The data that we see, basically most of the cases do not happen immediately because it is an immune response. It takes some time for the clots to happen. So in the cases, they see that the majority happen between 4 to 14 days. But the general guideline is to be vigilant up to about 4 weeks post-vaccination. So that first 2 weeks, but it wouldn't start immediately. It wouldn't begin immediately. It will need a couple of weeks post-vaccination before you start to get any symptoms to suggest thrombosis, and up to 28 days, but probably up to 14 days is where most of the thrombosis occur.
All right. Dr. Jamila, I know you're not a person to shy away from difficult questions, and I'm here to ask the difficult questions. So very frankly, have there been any deaths associated with any vaccine administered in Malaysia? And if so, did the patients have a pre-existing condition?
So far from we have something called the Vaccine Committee and the AEFI, the adverse effects sort of monitoring, and the deaths that happened, there hasn't been anyone that is directly linked to the vaccine. And this is why some of the results have to take time, because it is now mandatory if you've had a vaccine and, you know, unfortunately someone dies, they have to have a post-mortem so that we can determine the cause of death as much as possible. To my knowledge, so far, there hasn't been one directly linked to the vaccine itself.
All right, wonderful. I think Henri has a question for Dr. Jem about gynecology. Henri, go ahead. You wanted to ask if, as a breastfeeding mother, how a breastfeeding mother could monitor themselves and their health post-vaccination and in preparation for the second dose. I think we are.
Yeah, actually, just asked the question. Yeah, is there any way that, because, you know, I know that there's not enough data, but then is there any way that we can actually take care, and in terms of, you know, when we're still breastfeeding, a post-vaccination?
Yeah, Henri, Henri, you're a role model for women who are lactating. So I really want to thank you for doing that. You monitor yourself as though you are any other person. You know, if you have any, you know, headaches that are persistent, or, you know, you feel unwell after, and as Prof. Sharifah mentioned earlier as well, we are monitoring up to 30 days. So, you know, if you have any thing that you're worried about, you know, go and see your doctor and tell them that you've been vaccinated, because you've had AstraZeneca. So there are some particular things you look for, things like persistent headaches that are not going away, you know, blurring of vision, loss of balance, and nausea that's persistent, or vomiting, which is important for you to monitor.
Okay, so one of the most important tools the medical and research fraternity has is the feedback on your MySejahtera app. You will notice, viewers, after you've taken your first vaccination, there is a button to click to report symptoms. So these symptoms are all collected so that the researchers will be able to compile a better list of post-vaccination efforts. So as we move to the end of the show, doctors, I want to ask something about psychosomasis and how their reports may throw data off. For the layman, a psychosomatic is a person who imagines they have symptoms and reactions when in reality they do not. Professor Adiba, specifically, I would love you to weigh in on this, please, as a researcher and somebody who I really think has a great sense and sensibility about psychosomasis.
Could you repeat that? About what was that? Sorry.
For the layman, people go in, they take their vaccinations, and then they are told to report any funny signs, symptoms, right? But sometimes people report symptoms that aren't really there. It's a psychosomasis.
Okay.
What is your take on, you know, reporting on a psychosomasis? Well,
I think, you know, psychosomatic symptoms for us medical people is really a diagnosis of exclusion. So we will need to take, you know, whatever the patients complain, and particularly in this kind of situation where, you know, there's so many unknowns, so many you know, reasons to be even more cautious than normal. So I think we have to believe whatever the patient is saying that they have, and only after we've excluded the real physical you know, symptoms or signs can we ascribe it to psychosomatic. It would be very dangerous to kind of immediately think this patient is making it up. Okay. Unless, of course, they come repeatedly and, you know, like a boy who cries wolf and say, you know, I've got this, I've got that, I've got that repeatedly. But in the first instance, it's, you know, we need to invest, or at least probe deeper until proven otherwise.
All right. So what would you say to our viewer who said she was given the AstraZeneca vaccine yesterday at 12:30 p.m. Now at 5:30 p.m. there is a bump on my lip. Should I be concerned? How do we address something like this?
Well, I think, you know, whoever she, I mean, I don't think we should be answering that question directly here, because we're not here to take on, you know, a medical consultation. But you know, if she's very concerned, then she needs to go and see someone about it. I know this sounds like I'm fobbing it off, but I'm not, because, you know, I hate to be dismissing something that's significant, because we're not really able to take a full medical consultation online like this.
Absolutely. So the same goes to the person who asked about whether the AZ vaccine will have an impact on migraine sufferers who also suffer from sinus. It's a very, very general question. It's very difficult for our doctors to say just yes.
That's slightly different because, you know, that can be based on the post-vaccine rollout and this, but when it's specific to I just had the vaccine yesterday and this has happened to me, it's very difficult for us to answer that directly. But if you're a migraine sufferer, will the AstraZeneca vaccine make it worse? The answer is probably not, because it's, you know, like a different mechanism altogether. The thrombosis that Farida talked about is very specific in terms of the immune reaction and what it does, whereas migraine is usually a spasm of the blood vessels.
Okay. Riding on that, Professor Adiba, maybe one of our few final last questions. Viewer has said, we're going for our second dose of Pfizer next week. I've been advised not to take my blood thinner on that day. Is this advice medically sound? Dr. Sharifah?
Yeah, Sharifah maybe.
It's basically, if it's because you're going for an intramuscular injection. So if you've taken your blood thinner medication, sometimes you may develop a little bit of bruising or hematoma at that area if it's not compressed well. But it doesn't mean that if you've, you know, accidentally taken it in the morning, therefore you cannot go for your vaccination. It just means that we'll have to observe you for a little bit more and just make sure that we compress it well after the vaccination. Because often, you know, especially in the community, we may not be able to get hold of you before you come for your vaccination. So if you're taking things like aspirin or Plavix, you know, these kind of blood thinners, you can continue with your vaccination in the community. So if you've taken it in the morning, then it just means that you have to compress it a little bit longer. But those coming to the hospital, those on other blood thinners like warfarin or any of the NOACs, it would be good to consult your physicians beforehand. And once you know when your dates are, then to miss the dose and then take it after the vaccination, a few hours after or the following day.
So
Yeah.
a person who is taking a blood thinner after an angioplasty procedure is able to be vaccinated?
Yes.
Absolutely. Okay, great.
Yeah. Karen, I'm going to caveat that. I think that anyone who's had a bypass is probably going to be on a stronger blood thinners. So this is another group that has to have a medical consult, and there's a little form that will be signed by the doctor to say you can be vaccinated. You can be vaccinated, but they may require you to do a blood test to look at your INR. They may advise that maybe you are better off vaccinating in a hospital setting or clinic setting rather than a mass PPV. But if you're on aspirin and other things or any blood thinners and you're certified to be vaccinated in a mass setting, please just remind your vaccinator that, can you compress my injection site a little bit longer? Because it's just to prevent the bleed from bleeding into your muscle. Otherwise, it'll be very uncomfortable. But you know, at the mass vaccine centers, we are like Speedy Gonzalez, like we're trying to get people going through the line. So it doesn't have, you know, if I'm vaccinating, you'll know that I'll be chatting away with you and asking you all sorts of questions, but, you know, also offer that information to your vaccinator.
Okay, awesome. Okay, so thankfully, we've addressed nearly all the questions that needed to be addressed. The final one, Dr. Jamila, is to you. What are the opinions? What are your opinions on the Sputnik vaccine?
Okay. I knew that would come. I also saw a question, why doesn't the government procure more vaccine brands? The short answer to that is this is not like buying, do we buy Adidas or Nike, right? Nike. I mean, these are serious medication drugs, and we have to look at safety and efficacy. So NPRA will go through every portfolio that is submitted. So just for everyone's knowledge, we have Sputnik, which is the Russian vaccine, as well as CanSino, which is the Chinese single-dose vaccine, being evaluated by NPRA right now. Both these vaccines have not been approved yet by some WHO or the other, European. I think Europe has approved Sputnik, but not FDA. So, it's a process. And we're all hoping that, the more vaccines, obviously, that are approved, the more choice we have, the more volume. But I want to reassure Malaysians of this. Come July, the volume of vaccines we will be receiving on the shipment is going to really escalate. And we can now produce 500,000 Sinovac per week, right, at Pharmaniaga. And Pfizer will then really pick up their delivery by July, because it's a global delivery system. By August, September, we will have about 60% of our total needs. My phone has fallen. 60% of our total needs by August, September, which is good. We need 70%, as you know, for herd immunity. Leave us to worry about this. Let us get the vaccines into the country as quickly as we humanly can. But please encourage your family, your friends to register for the vaccinations. We've only achieved 40% right now. We've got to achieve 70% of our vaccine. And I think I'll just add on the whole question now around, do we vaccinate a 12-year-old and above? So the US has approved it, and UK as well. So I think that it will be a matter of time. Again, Pfizer has will put an application into NPRA for them to evaluate the safety of that, and to then decide whether we administer to the 12 to 15-year-olds. And this is why Malaysia's vaccine procurement policy has exceeded 100%. That means it doesn't want to just buy 70% of needs, because we have already planned in case we need either a booster shot or younger people to be vaccinated.
All right.
But sorry, Tan Sri, if I may, we're allowed to agree to disagree, can? That's why it's Sense with Science. I really do think there needs to be more urgency in vaccinating the 60-year-olds and above, or maybe absolutely. The 50-year-olds and above, because right now the crisis is in the beds, is in the ICUs, and these are the people that we are seeing in our ICUs. Yes, there are younger people now, but that's because we have so many people infected. But overwhelmingly, those who are getting severe disease still remain those over 50 with diabetes and obesity. So I think we really need to focus.
Completely agree.
And my fellow people, there's only 30% of Kelantanis who have signed up. So I don't know what's going on there. I don't think we can blame it all on vaccine hesitancy. Mungkin they don't know how to use MySejahtera. Mungkin they've not even heard of
Adiba. Adiba, you and I are on the same page on this. I mean, it's absolutely crucial to get the older population that actually die as a result of COVID-19 compared to the younger population. So please get your loved ones vaccinated. On Kelantan and Terengganu, I will share with you that I was in Terengganu, and the health departments are going door to door and calling older people who just refuse to come, and they're saying that, oh, my son or my daughter registered on MySejahtera, but you know what, give other people first, I want to see. So I don't know how, and I think, I just want to stress one point here. Unless people change their behaviors, whether it's towards vaccines or COVID-19 itself. I mean, there are people still, curi-curi balik kampung, going into, religious gatherings now are also a cluster. We've got to change the way we behave. We have to take this very, very seriously, not just in terms of getting people vaccinated, but our own individual daily lives. This is very serious right now. And no matter what policy or what, MCO you put in place, if people don't comply, we're in trouble.
Tan Sri, can I just suggest that, just a suggestion here. I feel that, these older people who have not even registered, they listen to certain people in their groups, right?
Yeah.
So maybe we need to change the way we approach them.
Yeah. No, you're right. You're right. We're asking religious leaders to speak to them. We've got to send Adiba back to Kelantan, to speak to them, Adiba.
With vaccine in hand to just chocho them at the same time.
Yeah. On that note, I don't know whether you've been following this. In the UK and in the US now, it's opportunistic vaccination, right? They're going into subways and just vaccinating people. They're not even observed. And New York subway is not the cleanest place on earth, but they're just jabbing people.
Line up and get your vaccine lepas Sembahyang Jumaat after the
absolutely.
It's a khutbah on why it's important to vaccinate.
Yeah.
All right, ladies, we have to wrap up now. We are an hour and 30 minutes into the chat. I just want to say to our viewers, thank you for the great engagement that you've given us. So much positive feedback. I thank you to the listener or the viewer who said to us how positive her experience at PWTC was and how she so valued the volunteers and the medical officers who were there. I thank you for taking the time to edify these people. It's so important that they are given their dues worth, for all the work that they do. So thank you for taking that time. For the person who actually said that the vaccine hotline is inefficient and does not troubleshoot, so we are not more enlightened. I have to say that sometimes you need to make the effort to go to the sources that you trust, trustable, credible sources, and get the answers for yourself sometimes. That's one of the reasons why Sense with Science was premiered. It was so that the common man or woman would get a hotline into doctors at the forefront of the issue. So join us again next week. But before we finish, having heard our specialists speak, Andre, are you feeling more confident and assured about your decision to be vaccinated?
Yeah, I think for sure, I don't doubt the fact that getting vaccinated is the right thing to do. Yeah. So I'm like, I am, but of course, I'm also now really excited to see the further rollouts of, hearing what Tan Sri actually said, what in come July that there's more vaccine. I think I'm really looking forward to that because I know for a fact that family members around me, some of them they're not really sure what to do, and I feel like all these new information, all these new updates will actually really help them and guide them to kind of getting their vaccination as well. So
awesome.
Yeah, I'm really looking forward to that.
All right, thank you so much for being on the show with us today, Andre, and thank you for your thoughts and the responsibility of care you have not only to your baby and your family, but to the rest of the nation as well. So before we come to the end of the show, can we have your final thoughts, Dr. Sharifah, and some closing remarks on your side, please?
I just hope that with this session that, we've given everyone here, the viewers, some information on the risks and benefits of vaccination, and hopefully everyone agrees that the benefits far outweighs most of the risk of vaccination, and just to get everybody to sign up and get vaccination and get vaccinated the moment they're called up for it.
Awesome. Thank you so much. Professor Adiba.
Yeah, I hope if there's any of you out there who was still not convinced, I hope we've managed to convince you, and not only convince you, but turn all of you into ambassadors. We need to get that word out that, all of us need to be vaccinated as quickly as possible if we want to return to any sense of normalcy. One is, of course, we don't want to get severe disease and end up being looked after by Sharifah and I, from severe COVID. But if you look at the real world data, the US, remember how bad they were a few months ago? Now they're opening up. They're going to be able to enjoy their summer, the Israelis, to some extent, the UK as well, although they're worried about the Indian vaccine. So if we don't want any more MCO 3, 4, 5, 6, 7, please, please, please get yourselves vaccinated. Sharifah and I are, at our wits' end, trying to find more beds for people getting sick with COVID-19.
Very sobering. Thank you, Professor Adiba. Dr. Jim, your final thoughts? Okay.
We need the PMO to give her better network lah. Macam mana ni?
Call up the CEOs of the telcos and ask them to give her a hotspot wherever she is. Andre, perhaps you can give us your final thoughts. We've come to the end of yet another science-led, evidence-based session, but this time it was a lot more personal by your vaccination experience sharing. So would you like to sum it up and a final message perhaps to the people that listen to you and the people you are in particular fraternity to?
I think a lot has been said by all the specialists here, but for me, I think I come from a very personal space. The fact that I am a new mother, I'm a first-time mother and a parent, and I understand a lot of people are very hesitant about what they need to be doing, and I think those concerns are for sure valid, but I always go back to whenever I feel a little bit unsure about my decision, I always go back to what that conversation between myself and the medical consultant is the fact that the numbers are very bad, and there's nothing worse than getting COVID at this juncture. So I think then the only way to get out of it, as mentioned, is just by getting vaccinated. I think that should be the priority, and I feel like we can deal with whatever we need to deal with after. But right now, the biggest problem is COVID, and we need to get vaccinated to kind of help each other get through this. So,
absolutely. Yeah. Thank you, Andre. That was very, very well said indeed. To our viewers, I have to say that Dr. Jamila Mahmood got cut off again. She asked that we please thank everyone for her on her behalf, and to tell the audience to start complaining about the things that they're complaining about. Basically, we take care of ourselves, and you have every right to have an opinion, but unless you are helping to advocate change, unless you're being the change itself, I think you need to look at the things that you say and the things that we all say, because whether we like it or not, we are all in this together. So we will see you, Malaysia, next week, same time, same place. Until then, keep safe, my nation. Stay home, but open your hearts to those in need of kindness and support. I'm Karen Michaela Tan, signing off for the Sense with Science team. Thank you for joining us today. Thank you, Dr. Sharifah. Thank you, Professor Adiba and Henri too.
Thank you.
Thanks, Karen. See you all next week.
See you next week.